Okay, so the next categories that we're going to talk about did not really have enough room to take up a whole poster board, so we have 3 on one page. The first category are synthetic prostaglandins, and the name of this actually continues on to be synthetic prostaglandin E1 analog. See how we have it big here? And then we have something teeny tiny right there. There's only one drug here that we need to learn, and it's misoprostol, which the brand name is Cytotec. This drug is used for the prevention of gastric ulcers from NSAID usage, and it can also help ready the cervix for childbirth. So obviously, if it's going to help ready the cervix for childbirth, it's contraindicated in pregnancy. So, duh. That's all you really need to know about that. So it can work with NSAIDs to prevent gastric ulcers, but it readies the cervix for childbirth. So pregnant women shouldn't use it. The next category of drugs that we're going to talk about are drugs that are used for gout. Now, these drugs work in 2 different ways. One drug works in the body as a whole, and the other drug works in the joint. Gout happens when there is an overproduction of uric acid in the body, and the uric acid settles on the joints and like crystallizes and causes a lot of pain. So obviously we don't want that to happen. So you would take something that you could either prevent that from happening, prevent the overproduction of uric acid, or could help it short term, make it feel better. So the first thing we're going to talk about is the overall stop the uric acid from overproducing in the body. And the drug for that is Allopurinol, which the brand name is Xyloprim. I'll let you see that. That's how you spell it. Allopurinol, and the brand name is Xyloprim. This drug acts in the body. It's preventative. It's not for an acute gout attack, and it stops uric acid from forming. So the adverse effects include agranulocytosis, GI issues, aplastic anemia, and Stevens-Johnson syndrome. The nursing implications is that you want your patient to take this with food to prevent nausea and vomiting, that they should not take this with alcohol. There's going to take about 1 to 2 weeks to see the drug effects in the body, and this can also prevent tumor lysis syndrome when a patient is undergoing chemotherapy. The other drug that works in the joint that is more of a short-term solution is, okay, let's see if I can say this, colchicine? No. Colchicine. I really don't know how to say it. Colchicine. The brand name is Colcrease. Crease, however you say that. I don't really know. This drug acts in the joint. It decreases inflammation response to the urate crystals that are in the body. And so this is a short-term drug. Remember? Short-term. Contraindications include GI issues, hepatic and heart disorders, and the adverse effects include nausea and vomiting, short-term leukopenia, and GI bleeding. So remember for gout that there's 2 different ways that we can treat or prevent gout. We can prevent it with allopurinol, which there is a P, so you can prevent it. Preventative stops the uric acid from forming. And then colchicine, I don't really know how to say it. This is going to treat it once it's already happened. So you see how there's 3 different C's here? Those C's, you could think of crystals, urate crystals or uric acid in the body is already there, already in the joint. You want to make the pain go away. You want to help lower those levels. So lower the inflammation response. So you're going to take, however you say this name. Luckily, both names, both the brand name and the generic name for allopurinol, which is Xyloprim, both have P's. So you can think of that as a preventative measure for gout. And both the generic name and the brand name for this drug down here both have C's. So you can think of it as it's going to treat the crystals in the body. And I know that sounds like crystal starts with K, but you know crystal starts with C. So there you go. You can think of it that way. Okay, now we're going to talk about immunosuppressants. Some drugs over here. We have 4 different drugs. This is actually a category of drugs, but we're just going to talk about it very briefly. Immunosuppressants in general, the goal is to decrease or prevent immune response. This happens by suppressing the T lymph cell lines. This can be organ transplant, but it also can be used for rheumatoid arthritis. Remember, RA is rheumatoid arthritis and OA is osteoarthritis. And it can also be used for multiple sclerosis. I want you to remember that with immunosuppressants, this is a lifelong therapy. The patient has to be on this drug for the rest of their life because we're trying to prevent the body from attacking itself, essentially. So you get a new kidney from your friend, your body's going to think that that kidney is not yours, which it's technically not. It's technically Joe's, but you need to tell your body, hey, slow your roll. Don't attack that kidney. We like that kidney there. So this is a lifelong therapy. It's trying to lower your immune response, so you're going to be more susceptible to infections. So the primary side effect of immunosuppressants are opportunistic infections. I want you to remember that. Immunosuppressants, primary side effect, opportunistic infections. So you need to tell your patients to always take precautions, especially during cold and flu season, to stay away from the sick people and don't touch things that are in the public and use hand sanitizer and wash your hands. Okay, a little tangent. Now we're going to talk about the drugs. Corticosteroids, in general, glucocorticoids inhibit inflammation. So 1 done. 2, cyclosporine, the brand name is Sandimmune. This stops the activation of T cells. So this can treat RA, rheumatoid arthritis, psoriasis, and it can also prevent organ rejection. Nursing implications is that you don't want your patient to eat grapefruit or drink grapefruit juice. Do not use a styrofoam cup because the styrofoam can actually take away, I don't remember exactly how my teacher explained this, but she said you don't want to put like the drug in a styrofoam cup because the styrofoam leaches away the medicine. I don't know how that works scientifically, but just don't use styrofoam cups when giving this medicine to your patient. There's also a narrow therapeutic index, so you'll have to monitor those levels to make sure that your patient's right there at therapeutic and not toxic and not subtherapeutic. The adverse effects of cyclosporine include hypertension, toxicity of the brain, liver, or kidney, diabetes, gingival hyperplasia, where there's overgrowth of the gums in the mouth, and also hirsutism, I think that's how you say that, where there's excessive facial hair growth in females. So I don't have any facial hair. There we go. There is a black box warning for cyclosporine, and it includes renal impairment, an increased risk of serious infections, liver injury, seizures, encephalopathy, and skin cancer. So those are things you don't want to play around with. Okay, the next drug is tacrolimus, limus, however you say it. The brand name is Prograf. This also stops the activation of the T cells. This is to prevent organ rejection, and it can also help treat autoimmune diseases. It's contraindicated in patients who have renal or liver impairment. Its adverse effects include headache, GI issues, pleural effusions, and toxicity of the kidney and the brain. Now, in our class, when our teacher was going over the different adverse effects of this drug, we looked at it in our book, and there were so many different adverse effects that went along with toxicity of the kidney and the brain. So toxicity of the kidney is nephrotoxicity, and the brain is neurotoxicity. So I'm going to read it from our class notes. Nephrotoxicity includes albuminuria, dysuria, acute renal failure, and renal tubular necrosis. So sounds like ultimate death and destruction of your kidney. And then neurotoxicity can include agitation, anxiety, confusion, hallucinations, and neuropathy. So that's stuff you don't want to play around with. But if the doctor is giving this drug, he's probably done his research and says, this is the best drug for my patient. But there's just some adverse effects to look out for in your patients that are taking this drug. Nursing applications for this drug are very similar to the one above it, where there's no grapefruit, no styrofoam, but this drug, you also need to make sure that the drug does not get direct exposure to sunlight. So most of the time, the bottles or the packages that these drugs are in have some type of protective barrier. So like it'll be a dark glass, or it'll be like a plastic bottle within a tube or something that will be able to protect it from sunlight. But I mean, it varies, you know. There is another black box warning here. This drug has increased risk of infections and also the possible development of lymphoma. So the last drug here for immunosuppressants include mycophenolate Cellcept, and is for rejection prevention, just like these two. Adverse effects include hypertension, peripheral edema, and tachycardia. Nursing implications are that your patient's going to need 2 forms of oral contraception. You need to monitor the CBC values, and pregnant women, so nurses or family members that may be handling this medicine, pregnant women should not handle this drug. And the reason why is that there's a black box warning that there's a high risk of birth defects in the baby. There's also an increased risk of infection, progressive multifocal leukoencephalopathy. Say that 5 times fast. And this drug stops T cell proliferation. So these 2 drugs stop the activation of T cells. This drug stops T cell proliferation. These 2 drugs are, let me make sure I have this correct again, calcineurin inhibitors, while this drug is an anti-metabolite. So they differ a little bit. They're all going to kind of do very similar things in the body. So those are the 3 categories. We have the synthetic prostaglandin, which is misoprostol, which can help prevent gastric ulcers from patients who are taking NSAIDs, and also ready the cervix for labor. The 2 gout drugs that help prevent gout attacks and help treat crystals from the gout attacks. And then you have immunosuppressants over here that are all trying to prevent immune response, and it's a lifelong drug therapy. And yeah, there you go. Lots of fun stuff.